If your blood pressure numbers look good, it's very easy to believe everything is working the way it should. That belief feels logical. The reading is lower. The goal has been reached. So the treatment must be correct. But this is one of the most common misunderstandings I see in people over 60. My name is Dr. Warren Hung. I'm a medical doctor, and on this channel I focus on helping you understand how the body changes with age so you can avoid problems that are often preventable when caught early. If you find this kind of clear, practical explanation helpful, consider subscribing. It helps you stay ahead of issues that tend to develop quietly over time. Now, here's the part that often gets missed. Lowering a number is not the same as protecting the body. Blood pressure is not just a target on a chart, it is a balance. Your brain, your heart, your kidneys, and your blood vessels are constantly adjusting to keep that balance stable. When that system is young and flexible, it can absorb a lot of change without much trouble. But after 55, and especially after 60, that flexibility starts to narrow. The same medication that once lowered your blood pressure smoothly can begin to push that system too far in one direction. And when that happens, the problem is not always obvious. You may still feel fine. You may still see a good number on your home monitor. And yet, underneath that number, your body may be working harder to compensate. This is where I want you to pause for a moment and think about something very simple. Blood pressure is not only about pressure, it is about flow. Your brain depends on steady blood flow every second. Your kidneys depend on it to filter waste. Your heart depends on it to supply oxygen to itself. If pressure drops too low at the wrong moment, or if the body cannot adjust quickly enough, those organs feel it first. And the changes that come with age make that adjustment slower. The reflexes that help you maintain stable pressure, when you stand up, when you move, when you wake up in the morning, those reflexes become less responsive. So, a medication that lowers pressure aggressively can create brief drops that you may not even notice clearly, but your body does. This is why dizziness when standing is not something I ignore in older patients. It's also why unexplained fatigue, lightheadedness, or even mild confusion can sometimes trace back to how blood pressure is being managed. Now, another layer that often goes unnoticed is the role of the kidneys. Your kidneys act like filters. They control fluid balance, electrolyte levels, and help regulate blood pressure itself. But kidney function gradually declines with age, even in people who feel healthy. So when certain blood pressure medications change fluid levels or electrolyte balance, the kidneys may not handle that change as easily as they did 20 or 30 years ago. And again, the signal is often subtle. It may not be pain. It may not be something dramatic. It may show up as slight weakness, a change in energy, more frequent urination at night, or lab changes that are easy to overlook if no one is watching closely. This is where another common assumption can become risky. Many people believe that if a medication has been used for years, it must still be the right choice. But the body you have at 65 is not the same body you had at 45. Your circulation behaves differently. Your fluid balance is more sensitive. Your nervous system reacts more slowly. And your margin for error becomes smaller. So the question is not just, is this medication lowering my blood pressure? The real question becomes, is this medication still the right fit for how my body works now? That difference matters more than most people realize. Because some blood pressure medications can increase the risk of falls, dehydration, electrolyte imbalances, kidney strain, and even subtle changes in thinking or alertness. Not because they are bad medications in general, but because they can become mismatched to the needs of an aging body. This is also why I'm careful when a patient tells me, I feel okay, so I think everything is fine. Feeling okay is reassuring, but it is not a full measure of safety. Many of the problems related to blood pressure treatment develop quietly at first. No pain, no alarm, just small changes that build over time. And this is exactly where careful choice and sometimes adjustment of medication becomes so important, especially after 60. So, in this discussion, I want to walk you through something very specific. There are certain types of blood pressure medications that I am particularly cautious about in older adults. Not because they should never be used, but because they require a different level of attention, and in some cases, a different approach altogether. Understanding why will give you a much clearer sense of how to protect yourself not just from high blood pressure, but from the unintended effects of treating it. And once you see how these medications interact with the body as it ages, the way you look at blood pressure treatment may change in a very important way. When blood pressure is discussed, it often sounds simple. The number is high, so it needs to come down. But inside the body, that number is being controlled by several systems working together at the same time. Your blood vessels can tighten or relax. Your kidneys adjust how much fluid stays in your body. Your heart changes how strongly and how often it pumps. And your nervous system makes constant small corrections to keep everything stable. In a younger body, these systems respond quickly. If pressure drops slightly, the body corrects it almost immediately. If fluid levels shift, the kidneys adjust with little strain. But after 60, that coordination becomes less precise. The first change is in the nervous system. The reflex that keeps your blood pressure steady when you stand up, called the baroreflex, becomes slower. In simple terms, your body takes longer to notice that pressure has dropped and longer to correct it. This is why some people feel lightheaded when they stand, especially in the morning or after sitting for a while. Now, if a medication lowers blood pressure strongly, that delay becomes more important. The drop is not always dangerous in a single moment, but repeated small drops can increase the risk of falls or reduced blood flow to the brain. And this doesn't always feel dramatic. It can show up as a brief moment of imbalance, a need to steady yourself, a sense that your head feels light for a second. Many people ignore this, assuming it is just part of getting older. But often, it is a signal that the system is being pushed a little too far. The second change involves the kidneys. Your kidneys regulate fluid, sodium, and potassium. They also help maintain blood pressure by adjusting how much fluid is kept in circulation. Over time, kidney filtration naturally declines. This does not always cause symptoms, and many people are not aware of it. But it changes how the body handles certain medications. Some blood pressure drugs work by removing fluid from the body. Others change how the kidneys handle sodium or potassium. When kidney reserve is lower, these effects can become less predictable. This can lead to dehydration that develops gradually, electrolyte imbalances that affect muscle and nerve function, changes in kidney function that only appear on lab tests. And again, these changes often do not cause immediate discomfort. They develop quietly. A third change involves the blood vessels themselves. As we age, blood vessels become less elastic. Instead of expanding and adjusting smoothly, they become stiffer. This means pressure can fluctuate more with changes in position, activity, or hydration. So when a medication relaxes blood vessels, the response may be stronger or less controlled than expected. This is one reason why a medication dose that worked well years ago may feel different now. There is also an important interaction between medications. By the time someone reaches their 60s or 70s, it is common to be taking more than one medication. Some may affect blood pressure directly. Others may affect hydration, heart rate, or kidney function indirectly. When these effects overlap, the total impact can be larger than expected. For example, a blood pressure medication combined with a medication for sleep, pain, or prostate symptoms may increase the risk of dizziness more than either one alone. This is not always obvious unless someone is looking carefully at the full picture. I remember a patient in his early 70s who told me he had started to feel slightly unsteady in the mornings. Nothing dramatic, no falls, just a brief moment where he needed to hold on to something when he stood up. He assumed it was just age. When we looked more closely, his blood pressure was dropping more than expected when he changed position. His medications had not changed recently, but his body had. After adjusting one medication and slightly modifying timing, those episodes resolved. And this illustrates something important about how the body works. The issue was not that the medication was wrong in general. It was that the match between the medication and his current physiology had shifted. That shift is subtle, but it matters. This is also where false reassurance can be misleading. If you check your blood pressure at home and see a good reading, that is useful. But it is only one piece of information. It does not tell you how stable your pressure is throughout the day. It does not show how your body responds when you stand up, walk, or wake during the night. It also does not show how your kidneys and electrolytes are responding over time. So a number that looks perfect can sometimes hide instability underneath. This is why in older adults, treatment is not only about lowering pressure, it is about maintaining stability, protecting organs, and avoiding side effects that can reduce independence or increase risk. And once you understand these changes, something else becomes clearer. Not all blood pressure medications behave the same way in this environment. Some are gentler and more predictable in older adults. Others require more caution because of how they affect fluid balance, vessel tone, or electrolyte levels. That distinction is what I want to make very clear next. And once you see which types of medications tend to create these problems, it becomes much easier to understand why certain choices deserve a second look after 60. Now that you understand how the body becomes more sensitive to blood pressure changes with age, we can look at the medications themselves. Again, I want to be very clear about something before we go through this list. These are not bad medications. Many of them are effective and widely used. Some are even first-line treatments in the right situation. But after 60, I am more cautious with certain types because of how they interact with slower reflexes, reduced kidney reserve, and increased sensitivity to fluid and electrolyte shifts. So let's go through them one by one. Number 1. Strong diuretics, water pills. These medications lower blood pressure by helping the body remove excess fluid through urine. Common examples include furosemide, hydrochlorothiazide, and similar drugs. On the surface, this makes sense. Less fluid in circulation means lower pressure. But after 60, the balance becomes more delicate. Diuretics can reduce blood volume, lower sodium levels, lower potassium levels, increase urination, especially at night. And when fluid drops too much, even slightly, it can lead to dehydration, dizziness when standing, increased fall risk. This is especially important in older adults because the body does not always signal thirst as clearly. So dehydration can develop without strong warning. There is also the kidney connection. Diuretics place a demand on the kidneys to regulate fluid and electrolytes. If kidney function is already reduced, even mildly, this can lead to changes that only show up in lab tests at first. So while diuretics are very useful in certain situations like fluid retention or heart failure, they require careful monitoring in older adults. Number 2, alpha blockers. These medications work by relaxing blood vessels, making it easier for blood to flow. They are sometimes used for blood pressure and also for prostate symptoms. Examples include doxazosin, terazosin. The issue here is how quickly they can lower blood pressure, especially when changing position. After 60, the body's ability to adjust to position changes is slower. So when someone stands up, blood pressure can drop suddenly. This is called orthostatic hypotension. It can cause lightheadedness, blurred vision, a feeling of instability, and in some cases, it leads to falls. What makes alpha blockers particularly tricky is that the effect can be strongest after the first few doses or after dose increases. So someone may feel fine for a while and then suddenly experience symptoms. For this reason, I am generally cautious with these medications as primary blood pressure treatments in older adults, unless there is a specific reason to use them. Number 3, centrally acting medications. These drugs lower blood pressure by acting on the brain's control of the nervous system. Examples include clonidine, methyldopa. They reduce the signals that tighten blood vessels. The concern here is not only blood pressure. These medications can also affect alertness, energy levels, mental clarity. In older adults, this can show up as fatigue, drowsiness, slower thinking, or even confusion. And because these symptoms can overlap with what people expect from aging, they are often overlooked. There is also a risk if the medication is stopped suddenly. For example, clonidine can cause a rebound increase in blood pressure if not tapered properly. So while these medications can be useful in specific situations, they are not typically my first choice in older patients because of how they affect the central nervous system. Number 4, immediate-release nifedipine, short-acting calcium channel blockers. This one is very specific. Calcium channel blockers are a broad class, and many of them are safe and effective. But short-acting forms, especially immediate-release nifedipine, can cause rapid drops in blood pressure. Instead of a steady, controlled reduction, the effect can be more abrupt. That sudden change can reduce blood flow to the heart, trigger reflex increases in heart rate, create instability in blood pressure control. In older adults, where the system is already less flexible, this kind of fluctuation is not ideal. This is why longer-acting, more stable versions are generally preferred when this class of medication is used. Number 5, high-dose combination therapy without reassessment. This last one is not a single drug, but a pattern I see often. Over time, medications get added. One drug becomes 2, 2 becomes 3. Each may be appropriate at the time it was started. But years later, the combination may no longer match the body's needs. High-dose or multi-drug combinations can increase the risk of excessively low blood pressure at certain times of day, electrolyte imbalance, kidney strain, drug interactions. And because each medication may be doing something slightly different, the overall effect can be harder to predict. What concerns me most is when these combinations are continued without regular reassessment. Especially after 60, medication plans should evolve. What worked 10 years ago may now be too aggressive, or simply no longer necessary in the same way. A quick clarification. I want to emphasize again, none of these medications are universally wrong. In the right patient, at the right dose, with proper monitoring, they can be very effective. But after 60, the question shifts from, does this lower blood pressure? To, is this the safest and most appropriate way to manage blood pressure in this body right now? That is a different level of thinking, and it is one that helps prevent problems before they become harder to reverse. Why this matters more than it seems. The biggest risk is not always the number on the screen. It is the hidden effects, the moment of dizziness that leads to a fall, the slow change in kidney function, the fatigue that reduces activity, the instability that increases risk over time. These are the outcomes we try to prevent, and careful medication choice plays a major role in that. But knowing which medications require caution is only part of the picture, because the real protection comes from understanding what to do instead, and how to manage blood pressure safely moving forward. Once you understand that blood pressure treatment is not just about lowering a number, the next step becomes much clearer. The goal is not simply control. The goal is stable, safe control that protects the brain, the heart, and the kidneys without creating new problems along the way. And this is where a more thoughtful approach makes a real difference. Let me walk you through how I think about this in practice. 1. Focus on stability, not just the lowest number. A very common assumption is, the lower, the better. But in older adults, that is not always true. If blood pressure drops too low at certain moments, especially when standing, walking, or waking up, it can reduce blood flow to the brain and increase fall risk. What matters more is how stable your pressure is throughout the day, how your body responds to position changes, whether you feel steady and clear-headed. A reading that looks perfect while sitting quietly does not always reflect what is happening in real life. So one of the most important things you can do is pay attention to patterns, not just isolated numbers. 2. Watch for signals the body is giving you. Your body often gives early clues when something is not quite right. These signals are easy to dismiss, especially if they are mild. But they matter. Pay attention to lightheadedness when standing, feeling unsteady for a moment, unusual fatigue, new confusion or slower thinking, frequent nighttime urination, muscle weakness, or cramping. These are not always just aging. They can reflect how your blood pressure is being managed, and catching them early allows adjustments before a bigger problem develops. 3. Ask the right questions at your next appointment. Instead of only asking, "Is my blood pressure okay?" Try asking, "Is this medication still the best fit for me at my age? Could any of my symptoms be related to how my pressure is being treated? Do I need all of these medications at the same dose?" These questions shift the conversation from numbers to safety. And that is where the most meaningful improvements often happen. 4. Monitor blood pressure in a more useful way. Home monitoring is helpful, but how you use it matters. Consider checking at different times of day, occasionally checking after standing, noticing how you feel, along with the number. This gives a more complete picture. Some people have good readings at rest, but experience drops when they move. That difference is important. 5. Review medications regularly. Medication plans should not stay static for years without review, especially after 60. At regular intervals, it is worth asking, do I still need this medication? Is the dose still appropriate? Is there a simpler or safer combination? Even small adjustments can improve how you feel and reduce long-term risk. 6. Understand the difference between control and overcorrection. This is one of the most important ideas to take away. Control means your pressure is managed in a way your body can tolerate well. Overcorrection means pressure is pushed lower than your body can comfortably handle. The difference is not always visible on a single reading, but it becomes clear when you look at symptoms, daily function, stability. Avoiding overcorrection is one of the key ways to reduce falls, kidney strain, or fatigue, and medication-related complications. 7. Build a simple daily awareness routine. Instead of trying to track everything, keep it simple. Each day, notice how steady you feel when you stand, whether your energy is consistent, if anything feels different from your usual baseline. This is not about worrying. It is about awareness. Small changes often appear before bigger problems. 8. A calm, practical way to think about it. If I had to summarize this in a simple way, it would be this. After 60, blood pressure treatment is not just about lowering pressure. It is about protecting stability, protecting organ function, and avoiding hidden side effects. That requires the right medication at the right dose for the body you have now, not the body you had years ago. If this helped you see your situation a little more clearly, consider subscribing. These explanations are meant to help you stay ahead of problems that are often missed until they become harder to manage. And if something in this discussion sounded familiar, whether it was a symptom, a medication, or a question you have been wondering about, feel free to share that in the comments. It helps guide what we focus on next. One of the most important things you can do after watching this is very simple. Take a moment to look at your current medications, think about how you have been feeling recently, and bring that awareness into your next conversation with your doctor. That small step can make a meaningful difference in how safely your blood pressure is managed moving forward.